Hello there, my name is Robbie Trower. I'm one of the sales managers here in the UK. Now, I've spent over a decade in workflow automation in both a sales and a pre-sales capacity. And over the years, I've engaged with a number of healthcare organisations to help them gain efficient control over the vast amounts of data they receive and generate. And I wanted to share some of my experience with you in this video. Now, across EMEA, there are a variety of different healthcare organisations, but broadly speaking, they fall into one of three categories. First up would be those that are not state funded. Second would be partially state funded. And finally, those that are predominantly state funded. Wherever you are in the world, one of these will be the predominant one. But either way, these organisations do not have a limitless amount of funding, and that's worth keeping in mind. Now, all over EMEA, organisations are coming under increasing pressure for many of the same reasons. First, advancements in healthcare has led to an ever-increasing population and an ageing population. There are so many health crises that modern medicine has been able to avert that 100 years ago we would have been powerless to cope with them. Add to this the increase in types of health issues caused by the changes to the way we live, such as obesity or mental health challenges, and it's clear to see an ever-increasing demand placed on our healthcare services. In summary, healthcare organisations all over EMEA are treating more people than ever, for longer than ever, and with more challenges than ever. Now, we work with hundreds of healthcare organisations, and we hear the same stories over and over again. The most crucial challenge that is universally being faced at the moment is balancing the increased demand for services against the reduction in funding that states are making available. So most healthcare organisations are focused on one or more of three areas in an attempt to bridge the gap between the money they have and the money they need. First up would be any methods of generating income. Okay, so in the UK, as an example, it is fairly standard to pay to park at the hospital if you're receiving treatment or visiting a friend or family member. It is also common to pay for printouts of x-rays and to contribute towards the cost of your prescriptions. Now, lowest on their focus area is the reduction in or diluting of available services. Now, this is avoided as it generally leads to increased waiting time and the danger of people not getting timely access to the care they need. And it's the last area is the space where Kodak Alaris are engaged, driving efficiencies in the way that healthcare organisations operate so they can do more with less. So for decades, we have been working with health organisations to help them find more efficient ways of managing the data they have and streamlining the time it takes for patient information to be available to clinicians. We are currently helping customers digitise healthcare records, reports, results, letters and other crucial patient information. And I want to walk you through one example of how we helped a large hospital in the UK make data available in almost real time. So let's take a look at the process for updating medical records. So we have a strong presence in organisations where the retrieval of records and access of information are time critical. And in this particular example, we will work in both the clinical and the records departments to help them ensure medical records get updated in a timely manner. So, healthcare records processing is something that isn't new to us, okay? But the key issue in this particular customer was that the latest medical information was being sent to the records department at the end of the day. Patient information was taking 2 days in a worst case scenario to be available to clinicians within the health record. Now, we have seen situations where documents were having to be transported between sites, and that can result in even longer delays. Each time a patient was admitted and treated, notes of the treatment and observations were taken, and these needed to be added to their historic record. Clinicians need to be fully informed to make the best decisions on treatment, and without the latest data available, patients needed to wait longer for the next phase of their treatment. So the process of making the latest patient data available to clinical staff was very manual and involved a lot of document handling and physical movement of paper, which was slow and expensive. Part of the problem here is locating the physical record. What if it hasn't been refiled correctly or it's sat on someone's desk? more delays. The knock-on effect of patients waiting in beds or departments for treatment meant that waiting times for new patients were extended also. Add to this that some of the documentation was lost in transit. This put a total halt to treatment, and the pressure faced by healthcare staff to meet waiting time metrics was intensifying. So we worked with the customer to understand their process end to end, and then developed a solution that met their requirements. By capturing the latest information on our Kodak Alaris scanners as soon as it's available, pushing that data into the digital record to update the patient care history, we were able to make the latest patient information available in almost real time. So clinicians got access to the information they needed to treat their patient within minutes of it being available, rather than days. The process is now handled more by technology than by people. We identified the bottlenecks and found that these were predominantly those steps where people were involved in physically moving data on paper. By removing these manual steps, we are reducing the total time and cost of the process. Medical records can be updated faster, and clinicians can have access to critical information when it is needed. So that's the how. Let's talk about the why. Now, the reason we are the preferred supplier for this particular customer. So first up, it's scalability of the solution. Recreating this process across the trust was simple. With our broad range of scanners, it meant we had a device for whatever volume a department needed, and our integration to our partner solution was tried and tested. We were able to support our partner so that the customer could get their end-to-end solution from one supplier, rationalising costs and ensuring accountability if there was a problem. And finally, and perhaps most critical to both our customer and partner, the image quality we are producing from our scanners. A scan is worthless if you cannot clearly see and understand the data in it. And our range is synonymous with image quality, data clarity, and the downstream impact that data accuracy provides. Thank you very much for your time. I hope you find that useful. Now, back to the studio.